My name is Dr. David Rapaport. I am a board-certified plastic surgeon, and I'm also the founder and medical director of CoolSpa. And what I'd like to do now is talk to you a little bit about the similarities and differences between CoolSculpting and liposuction. These are both procedures that we offer at CoolSpa. CoolSculpting is our biggest non-invasive procedure, and liposuction is the #1 surgery that I perform. So let's try to talk about this a little bit and gain a little more clarity in the differences and similarities between these two techniques. Why don't we start with CoolSculpting? CoolSculpting, as you may know, is the leading non-invasive fat reduction technology in the United States and I would say in the world today. It relies on the biologic fact that fat cells are more sensitive to cold than cells around them. So a Harvard scientist saw this fact and built a system taking advantage of this fact. So what CoolSculpting does is put applicators of different sizes and shapes over fatty deposits on your body, and what they all have in common is that they are lowering the temperature of the tissues, basically getting towards freezing those tissues to just the right temperature, just the right amount of time. When the treatment itself is over, the applicator comes off, and the technician then massages that treated area for about 2 minutes, because the cells that have been frozen are literally crystallized, and the act of massaging them vigorously helps break them apart. So what you end up with is, according to the FDA, an average of 20 to 25% permanent reduction in the treated spot. So if an applicator goes on somebody's abdomen, it grabs a part of that abdomen, it's treating it. Typically those cycles are 35 minutes, 2-minute massage, and what you can expect is, on average, a 20 to 25% reduction in the fat that was treated. So again, that applicator isn't treating the entire abdomen, it's treating the piece of fat that it pinches, and that's what's going to go down 20-25%. It's important for you to understand that. Now, how many treatments you need depends on how much fat there is, and it's also going to be variable based on how you respond to that treatment. So a typical abdomen, if this is the belly button, might have applicator here, 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 and here. So there'll be sort of a diamond shape of applicators drawn around the belly button. Those applicators can't go on at the same time because they bang into each other, so it's 40 minutes times 4 for that typical average abdomen. Again, some need more applicators, some are bigger, some need less. On the waist, we're treating each waist with usually 2 applicators per waist, sometimes 1, depending on how petite you are, how big you are. CoolSculpting is used really all over the body these days, under the chin, area in front of the underarm, the arms themselves, the male chest, the entire abdomen, the inner thighs, the outer thighs, the inner knees, the area above the knees, and occasionally the calves. It's completely non-invasive, as I said. There's no needle. The beauty is that the cold creates numbing, so most people tolerate this really, really well, although the massage at the end for the frozen bits, it can be uncomfortable. We've treated well over 15,000 people with CoolSculpting, and we've had, in general, excellent results, and you could visit CoolSpa.com and see those results, and you could certainly come in and talk to us. Again, it's not a treatment for weight loss, it's a treatment for correcting fatty disproportions, or another way to put that is fatty bulges. That's what it's about. You can be overweight, you can be obese and still get CoolSculpting, but it's not to cure the obesity, it's to improve specific problem areas, because each treatment isn't getting rid of a lot of fat. It takes about a month to see the result, and many times people come back and retreat the same area to get more results, and we also see even more people coming to treat other areas after seeing the results they got in the areas treated. So let's compare this to liposuction. So liposuction is a surgical procedure. It's done in my office, does not require general anesthesia. I do it under light sedation. Sometimes if it's limited areas, and depending also on your personality, we can do it under local anesthesia. It involves filling the area with fluid. The fluid has numbing medicine as well as a blood vessel constrictor in it, and then essentially sucking out that fluid and fat. There are other videos where I go into detail about the technologies that we use in liposuction, but suffice it to say that because I am physically sculpting the area, I have much more control over what I'm doing. CoolSculpting is a great technology, and it's customized as far as the shapes of the applicators and where we're putting them, but it's not as customized as liposuction. Furthermore, liposuction can reduce much more than 25% in an area. It can reduce sometimes even as much as 80% and more of an area if that's what we want to do. The scars for liposuction are really small. This is a little thing I draw on my hand every day when I talk to patients. We're talking about a little 4mm scar, whereas if it's in the neck area, it's half that size. It's really almost just a little poke. But on the body, we're talking about a 4 or 5mm scar, and that's it. Now, some people prefer CoolSculpting simply because even though this is a light procedure done with light or no anesthesia, people don't want a little scar. They don't want the word surgery. They just resist it, and that's that. And for those people, there's now CoolSculpting, and that's a totally non-surgical option. Other people sometimes come in, and when they hear what liposuction involves and how relatively easy it is, end up opting for liposuction. My job and our job at CoolSpa is to look at you, analyze your own situation, and give you the best advice possible so you know what you're getting and you know what you're not getting. It's impossible to say what's best for someone without seeing them, and you're going to always choose what you feel is best for you based on your sensitivities. It is important to understand that there's a lot of false information going around regarding liposuction. In general, I would say that over 90% of my liposuction patients are able to do liposuction, for example, on a Friday and go to work on Monday and engage in full physical activities, including sex and the gym, on Monday. Now, you're typically going to be bruised. Don't get me wrong, there's usually bruising after liposuction, but you're able to be at the gym, you're able to work out, you're able to fool around and do things like that. And most people will report that they feel sore, not pain. It's more gym type of soreness that can be significant, but it's not like pain of when you had your gallbladder attack. So I hope that I've shed some light on the contrast and similarities between CoolSculpting and liposuction. As you may or may not know, body contouring consultations at CoolSpa are complimentary, and therefore we invite you to come in here and have an individual consultation with an expert who really understands. And at CoolSpa, we have all the options, and so we'll give you honest information. I don't want to treat you with liposuction if you could easily have a CoolSculpting treatment, or if what you really need is a tummy tuck. We know how to look at you, and I hope we will communicate very clearly to you what's best for you and your individual needs, and that's what CoolSpa is all about. So thank you for listening, and I look forward to seeing you.